a psychiatric disorder in which anxiety and fear arise frequently and without reasonable cause. Panic disorder has a subdivision such as a panic attack, which is a sudden feeling of an acute and disabling anxiety. Physical characteristics. Physical symptoms during a panic attack, such as a pounding or a racing heart, sweating, chills, trembling, breathing problems, and weakness. Causes of a panic disorder. Genetics, major stress, temperament that is more sensitive to stress or prone to negative emotions, certain changes in the way parts of your brain function. Panic attacks may start off by coming on suddenly and without warning, but over time they are usually triggered by certain situations. Some research suggests that our body's natural fight or flight response to danger is involved in panic attacks. People who are prone to panic disorder. Panic disorder sometimes runs in families, but no one knows for sure why some family members have it while others don't. Physical differences also have been observed among people prone to panic attacks. Sensitivity to hormone changes, to medications, to physical stimulus, and to large amounts of sodium lactose. Prevention strategies. Panic disorder cannot be prevented, but people with this severe disorder may be able to reduce the number of panic attacks with home treatment. For example, patients can try relaxation exercises or limiting alcohol and caffeine. Warning signs. Difficulty breathing, sweating, person saying that he might lose control and die, trembling or shaking. Those are the key symptoms that we can see when someone is suffering from a panic attack. Signs behind panic disorder. During a panic disorder, your sympathetic nervous system is triggered. Impulses called action potentials originating in the amygdala travel down to the adrenal glands in your kidneys. The adrenal glands then produce norepinephrine and epinephrine. They cause your heart to pump faster and harder, and blood vessels to constrict. Blood flows towards your internal organs, endorphins giving you a rush and dulling your sensations of pain. Activity of frontal lobe decreases, which causes confusion, disorientation, and the potential for impulsive behavior. Interesting statistics. Panic attack duration is 10 minutes. 4 attacks over 4 weeks is a typical frequency of panic attacks. 3 million Americans suffer from panic disorder at some point in their life. The average age when panic disorders begin is 24. Female to male ratio is 72% to 28%. People who are married have more chances to have a panic attack rather than a divorced person. 51% of married people and 24% of divorced people have panic attacks. Most common myths about panic disorder. Panic disorder is a sign of weakness. Panic disorder is caused by a bad childhood. There is no real help for panic disorder. Panic attacks can make you go crazy and lose control over yourself. Panic attacks will cause extreme harm to your body. All of these myths are obviously not true and cause a lot of stigma towards people with panic disorders and panic attacks. 3 sources on how to deal with panic disorder. Number 1. Panic Center Beta is an online cognitive behavioral therapy. It offers personalized interactive tools that have helped thousands of people challenge and overcome their anxiety and panic. Number 2. No Panic National Organization, which has its own hotline with guidelines and counselors. This helpline is for those aged 13 to 20 years old. It opens between 3 p.m. and 6 p.m. Monday to Friday. Number 3. An anxiety and panic disorder meetup is a support group for panic disorder. People write responses and members of the group will elaborate on them. Actresses who suffer from panic disorders. An actress, Amanda Seyfried, suffers from panic disorder. She states that she regularly sees a therapist to cope with her panic attacks. Emma Stone also suffers from panic attacks. She said that the first time I had a panic attack, I was sitting in my friend's house and I thought the house was burning down. I called my mom and she brought me home. And for the next 3 years, it just would not stop. I would go to the nurse at lunch most days and just wring my hands. I would ask my mom to tell me exactly how the day was going to be, then ask her again 30 seconds later. I just needed to know that no one was going to die and nothing was going to change.
She is going through a panic attack. She has a breathing problem. Her heart is racing. She is sweating, has chills, trembling, and then weakness.
I have a panic attack. What's happening?
Sweetie, look at me. Hello, I'm a doctor. You're fine. Sit up straight. Look at me. Breathe in. Breathe out. You're fine.